Okay, Mike. Here's how I actually break down, those types of problems. Might point you in the right direction and maybe give you some of the things that you haven't thought about. When I get issues like that, when it's like just the movement is just blocked, my first question is like, can that joint actually go into that position? Is there something physically blocking, which hopefully not because they just had the meniscus surgery. Is it inflammation blocking? Is it muscle tension blocking? Is it nervous system blocking or protecting? So probably with that lady, you said the right knee was just doesn't extend. Arthur posted that the popliteus, yeah, definitely, because what happens, the popliteus is a flexor, right? It initiates the flexion and it turns the tibia inward to start the flexion movement. So to get full extension, that popliteus has to be able to lengthen and extend. So, yep, definitely target that popliteus, whatever you want to call it. So my thing is, let's check the joint. Does it actually go into full extension? So if the lady's, kind of struggling to get into full extension, in this position, you can basically press and to see if it actually fully extends. Okay, so check that. Maybe the hamstring is so tight here that it doesn't allow for full extension. So let's give the hamstring a little slack and see if it changes. So, you can do it here to try to fully extend. The more you flex the hip, the more tension there is in the hamstring. So we're going to take it the other way. We're going to put the hip into extension, give it a little slack, and see if that increases the ability for the knee to fully extend. Okay, so a couple ways you can do that. You can take them off here, add some hip extension here, and see if it actually extends, or face down. You can flip them face down, and I'll just take his right knee here. You can put them in extension, hip extension, and then see if it actually extends. Okay? So we're just seeing if, taking some of the muscular tension away gives that knee the ability to fully extend. Okay? Same thing with the gastroc, right? We can give some slack here. Okay? So we're going to shorten the gastroc, see if that changes. Because if you fully flex, you're going to put tension here. The gastroc crosses the knee joint. So this will be a lot harder than giving slack to extend this way. Okay? So try some of those to see if actually the joint can be extended. Okay? Next thing I do with, a lot of post-surgical stuff, you might want to look at the injury recall technique taught by Dr. Wally Schmidt. I'll put a link in there. I think there's a Sheldon. He's got a YouTube video, dealing with the nervous system to clear out post-surgery to see if that injury is still in the nervous system. So you can look at that thing there. Okay, so working popliteus, shortening and forcing extension. You can put the hip into extension to see if that gives you a little bit more room to work with. Also, checking myotomes, checking the other knee as well, because as Mark Panzer put in the comment section, why did that right knee get damaged? Maybe the left side is not working. So make sure you check the myotomes. Checking everything here, because when you treat this, there's a transfer into the brain that also treats this side. So look at that. You said, I think there was some hip movement, so definitely you got to work the hip and the ankle joint. Yeah, so joints above and below, seeing if that joint actually extends, working the nervous system, injury recall technique, and see if that kind of puts a thought in your head and maybe a direction to go with. Extremely difficult to put these things in. I might be totally off bound, but it might kind of steer you into different ways of working that knee. Okay. Couple of ways the knee that I work with is in a seated position. Okay, so go ahead and sit. Okay, I'll just give you another way of another position to treat the knee. In a seated position is great. They can actually connect with the hand, or you can slide it under the butt like this. Okay, so we'll just do that. We'll turn on. You can do it this way, but as I teach it, let's treat this side because I want to run those electrons through his spine and hit the nerve roots. Okay, so in this position, we have a visual. We can see how the VML works, right? We got some ways to measure how responsive it is and ways to see it. Okay. And then also for the patient to see, it's not responding. Look at the difference. Then you treat lateral. So ask yourself, what needs to happen for this knee to extend? Well, all these muscles have to shorten, all the front muscles have to shorten, and all the back muscles have to lengthen. So you want to treat accordingly. Okay. If the VMO is not moving and not contracting, well, is this the problem? Or maybe it's the hamstring not allowing it to go into extension and not being able to contract. Okay, so dealing with agonists and antagonists is very important. Don't be just sitting there and it's like not waking up. Try to release some of the other muscles to see if it actually comes back. Okay. Working some tendon issues in here as well is probably important. You can take a Graston tool or a fat tool and scrape the knee, scrape that, the fascia. You said it's all scarred up. Taking a fat tool to work the tissue, working ligaments of the knee to free that type of stuff up as well. I like to do that too. Tendon stuff. Putting TheraBands on, trying to get that knee to extend. Okay, so can also do TheraBand exercises. So she's sitting and she can't fully straighten the knee. Just wrap that TheraBand here, pulling forward, so it's pulling into flexion. So she needs to push the knee back into extension. That's another thing you can do with some exercise-based stuff. Treating in a standing position, treating the hamstring, quad muscle as she's exercising. You can try that as well. Treating the calf as well. Let me know if that helps, okay?